Hello, my name is Angela Wood. I will be presenting a registered nurse-delivered Medicare annual wellness visit business plan. Preventing chronic disease and keeping chronically ill older adults healthier are imperatives to drive improvements in health, quality of health, and value as part of the U.S. healthcare delivery system. A registered nurse-delivered Medicare annual wellness visit model, which is an expansion of services in the primary care clinic, has the potential to promote access to this benefit that might otherwise remain underutilized. This is a financially viable model and allows for alignment with Kentucky One Health's mission. The vision of the organization is to transform the healthcare community's care delivery and healthcare professions so that individuals and families can enjoy the best of health and well-being. As the implementation of the Affordable Care Act continues to shift the focus of healthcare toward disease prevention, the annual wellness visit has the potential to improve access and quality of care to Medicare's increasing population. The Medicare annual wellness visits are specific provisions aimed at adults age 65 and older. The Medicare Access and CHIP Reauthorization Act, otherwise known as MACRA, of 2015, is a value-based system, and annual wellness visits are one of those performance outcomes that are linked to reimbursement. Annual wellness visits provide its beneficiaries with a health risk assessment and personalized prevention plan. Research shows clinical pharmacists delivering annual wellness visits in primary care supports the cost of the pharmacist, generates revenue, and is financially viable. The evidence is applicable and transferable to an RN-delivered model. Using the framework model of improvement, Plan, Do, Study, Act, a plan for RN-delivered annual wellness visits in primary care clinic is proposed. The overall goal of the project is to improve the annual wellness visit rates of eligible Medicare beneficiaries and to prevent and manage chronic disease. Market analysis. Providers find it challenging and frustrating to deliver and document the extensive required elements in a 15 to 20-minute visit. Annual wellness visits can be provided by a licensed practitioner such as an RN working under the direct supervision of a physician. Currently, the primary care clinic for project implementation does not provide annual wellness visits. Overall, the organization is at 11% annual wellness visit completion, and the initial goal is to increase this to 20%. Chronic disease accounts for about 83% of U.S. health spending, and virtually all, 99% of Medicare's expenditures, are for beneficiaries with at least one chronic disease. Population-based prevention is effective in avoiding disease when strengthened with patient-centered primary care, illness detection, improved management of existing illness, and avoid additional disease and disability. Medicare annual wellness visits remain underused. The RN-delivered annual wellness visit can generate revenue for the practice and organization and save healthcare dollars spent on chronic disease. This service is marketable and profitable on the provision of improved health through clinical preventative care, health promotion, and disease prevention. Potential for expansion of the service could be to more days of the week to accommodate the number of Medicare beneficiaries within the practice, as well as expansion to other primary care clinics within the organization. In looking at a SWOT analysis, one of the most important strengths is that nurses are the most trusted profession in regards to honesty and ethics. A couple of weaknesses identified by the literature is that an on-site physician is required by Medicare, and there's potential lack of support from primary care providers. There's an opportunity to provide preventative care, decrease chronic disease cost, and increase revenue and reimbursement with this unique RN-delivered model. Threats would be healthcare organizations providing this service via phone, home visits, or community-based programs. The financial plan includes an RN, a medical assistant, and a medical clerk working 1 8-hour day per week, 50 weeks out of the year, with 30 minutes for each annual wellness visit. This allows for 15 patient visits per day, or 750 per year. Based on the reimbursement rate of an initial annual wellness visit of $172 and subsequent annual wellness visits of $111, and the assumption that out of the 15 patients, one will be an initial visit and the other 14 would be subsequent, this would generate $86,300 a year. However, one must account for missed or unfilled appointments and less initial annual wellness visits. The yearly salaries for an RN, a medical assistant, and medical clerk total $22,308. Therefore, if the RN provided care to 7 patients a day, with 25 initial visits per year, which is one every other week, the revenue generated is $43,150. The minimum number of patients an RN must see to break even is 6 a day for the first year, because this is taking into account the one-time startup fees of $3,500, which is going toward the check-in, check-out station and exam setup, and the operational budget, which is your staff compensation and overhead based on 15% of the total salaries. In subsequent years, this would allow a minimum of 5 patient visits per day to break even. There is not a capital budget required, since this is an existing primary care clinic with expansion of services and available exam space. The model will generate sufficient revenue for the first year startup budget, yearly operational budget, and enhanced revenue stream for the healthcare organization. Based on an advanced practice registered nurse, an NP's hourly compensation of $45 an hour, there would be a cost savings of $6,940 per year when compared to the RN delivered model. In addition to the yearly cost savings, this model also allows for more available patient appointments with a physician or the advanced practice provider that's not performing the annual wellness visits. Plan for evaluation. The team will track hospital admissions, emergency department visits, annual wellness visit rates via the electronic medical system. The project will follow a stepwise 12-month approach, and the Gantt chart will assist the team with activity completion in a timely manner. Thank you for your attention, and I am happy to take questions and comments.